share it on our social when it goes live.
Fantastic. Okay, I will actually disappear for now and put the slate back up. And I'll be with you guys in a couple.
Ryan, nice backdrop.
Thank you.
That looks good. Easier than the window.
Yes.
Okay.
The windows are a drag.
So I can't see who. There are a few reporters on, so we'll just wait a few more minutes. And I sent you all a chat if you want to make sure you see that in a couple minutes ago.
Catherine, right now we have about 6 reporters signed up.
Okay.
Probably expecting a couple more.
I can only see 3 that are on.
I'm just telling you who's registered
Okay.
through Zoom. Yeah,
Perfect. I just wanted to make sure I wasn't missing anything. So
sure. So we'll wait for a few others to join us.
And hi to the few reporters who are on already. It's nice to see names from throughout the district. So we have someone for Nelson and all over. It's good.
Catherine, I am seeing our 6 reporter registrants on board, so I can go ahead and kick us off if you're ready. Okay, at this time, I'd like to welcome our members of the media and those viewing the live stream to today's press conference with representatives from the Blue Ridge Health District. We are scheduled to begin now at 2 p.m. My name is Joe Rice with the City Communications Office. We are hosting the Zoom webinar, and I'll be moderating today's Q&A with our credentialed media in attendance. Just a few notes before I hand it over to Catherine Goodman, the Blue Ridge Health District's Public Relations and Communications Manager. After all speakers have presented, we will give each media outlet 2 opportunities to ask questions, and both opportunities will include your initial question and 1 follow-up question. We will make sure everyone gets a chance to ask their first question and follow-up before we move on to the second round of questioning. As always, please keep your questions respectful and thoughtful for all of our participants. We appreciate your participation, and with that, I'll hand it over to Catherine Goodman. Catherine.
Hi, everybody. Thank you for joining us today. We're happy to have you here. And Joe and the city, thank you so much for helping us with the technology to host this type of press conference. So we're looking forward to talking with everybody today, providing an update on our latest vaccination efforts and sharing or opening up to question and answers as we move forward. So I'd like to introduce the panelists that are here with us today. We have Dr. Denise Bonds, who is the health director for the Blue Ridge Health District. Ryan McKay is our COVID-19 incident commander, who's here to answer all sorts of questions about our vaccine plans, and Rebecca Schmidt, who is our director of partnerships and strategic initiatives. And then for those of you who I haven't met already, I'm Catherine Goodman, our public relations and communications manager. So we will go ahead and get started with a brief presentation for about 20 minutes, and then we'll walk into question and answers. And so, Joe, you can move to the next slide.
Hey, good afternoon, everybody.
Thank you.
Welcome. I'm Denise Bonds, as Catherine said. I'm the Health District Director. Here is the agenda that we'll try and go through today. Really, our focus today is on the vaccination plan and distribution and our equity initiatives. And if I could have the next slide, please. I do just want to give a brief overview so that we are grounded as where we are in this outbreak. The district has seen just under 12,000 cases so far, with about 500 hospitalizations across the entire district. 117 individuals have lost their life to COVID. Our current percent positivity, that is the percentage of PCR tests that are done in our district, is 3.6. I do want to make a note of this. While there has been a general downward trend of our percent positivity from our high earlier in this year, I do need to remind everybody that the UVA students are back, and UVA is now testing about 5,000 individuals a day, and that greatly skews our positivity rate. So it will always appear quite low while the number of tests are being done. If we could have the next slide, and then I will turn it over to Ryan.
My apologies, Catherine. I got knocked offline for a second. And
That's
with that,
okay.
I will actually make you a co-host in case that happens again. But I will get our presentation back online in 1 second.
Okay. And then Ryan, you'll be up next. And Joe, you can move to the next slide when you can. Thank you.
Thank you, Joe, and good afternoon, everyone. So here is a summary of where we are in terms of vaccinations across Virginia, and then also some numbers related to the Blue Ridge Health District. So in our district, over 58,000 doses have been administered. This includes vaccine that's been administered certainly by us at the Blue Ridge Health District. It also includes any other providers that are providing access to the vaccine. So that would include Sentara Martha Jefferson and the University of Virginia Health System, who have also been vaccinating both their employees and staff, but also some members of the community. We do not have specific information on those numbers, so it's an aggregate number that we're collecting from VDH that we're posting here. And the majority of the vaccinations that have been done in our district have been through or by the local hospitals. As you can see, there is a significant number across Virginia that's been administered, and then on the right-hand side there at that map, you can see our total numbers, and on the actual public website, you can scroll by locality to see how many per locality have been administered. Next slide, please. So to give you all a sense of sort of where we are, again, Virginia is following a set of prioritization phases that include a number of types of workers. Right now, we are still working through the 1As, and we have moved into some of the 1Bs. One thing to understand about where we are with our phases is that over the course of the vaccination campaign, new groups have been added to the 1As in particular. So most recently, primary caregivers, home health have added to some of those numbers. And so we are working right now through some of the lists that we have to make sure that we are able to provide access to those who are newly added, while also trying to work through and finish 1A, and then also getting into the 1Bs. There is a large number of individuals in both categories. And one thing that we've reported on before is that our vaccine allocation at the local level and certainly at the state level does not necessarily meet the demand for the total number of people that are eligible to get vaccinated at this point between 1A and 1B. Right now, Virginia is receiving about 120,000 doses per week. This is up just a little bit since the last time we held this briefing for the community. Those doses are primarily going through pharmacies to group homes and some long-term care facilities that didn't get onto the registration list at the beginning of this vaccination campaign. So we're not really seeing sort of a local impact as related to those 15 or 16,000 more doses that are coming into Virginia. As Governor Northam has reported, it will be March or April before we see significant increases in vaccine to meet the demand. So we are currently receiving 2,850 doses per week that we have to allocate to all of the individuals that are eligible, but also through our providers. So anyone who wants to dispense or administer vaccine has to get that vaccine through us. So we are working with a very small number to try to distribute and dispense to a large population across our health district. We have faced a number of challenges and we're working to try to get through those challenges. So a couple of things. One, different vaccines and supply problems. So we are dispensing both the Pfizer vaccine and the Moderna vaccine. And we don't have the same number of those doses coming in per week. And so that makes it logistically a challenge for us to sort of do our planning to make sure that we are providing those vaccines in ways that are safe, but also efficient. We've gone through some scheduling issues and problems. Some is that system space. So we started out with this program called VAMS, and now we're transitioning by the end of the month to a system called PrepMod, which is intended to provide a little bit more ease of use on the user's end to schedule appointments. With that, we've had some issues with scheduling our own appointments. Some of the information we've sent and tried to communicate to our community about scheduling has been difficult. We've had some challenges that we're trying to overcome. So we're trying to streamline our systems, reduce the number of people that are emailing individuals about their appointments, but also trying to do that in more of a timely manner. Weather has also been problematic over the last week and will continue to be this week. So we had to reschedule appointments over the weekend related to weather-related issues, which has also created some of the scheduling problems that we faced. Working through those systems, trying to provide more information in a clear way has been difficult. And one thing we want to report now is that in anticipation of snow and what could be significant ice Thursday into Friday, we're going to reschedule appointments on Thursday. So anyone who has an appointment scheduled for Thursday will be rescheduled for Saturday. And those who have appointments on Friday will be rescheduled for Monday. And we're making this decision now so that we can provide ample opportunity for individuals to receive information, to email and contact us if they don't hear from us, so that we can follow up with them with a significant amount of time for individuals to plan. And this is sort of one of our ways to try to fix some of the problems that we faced last week, so that decision-making happens sooner and communication can happen more effectively, more quickly, providing people with time to make adjustments over the course of the next few days. And we will be sending out information related to that today and tomorrow in anticipation of Thursday and Friday changes. And some of the other challenges that we faced is sort of the changing nature of the phases and the different groups that belong into those phases. So I mentioned earlier about home health and primary caregivers being added to that phase 1A category only a couple of weeks ago. And that makes it very difficult for us to sort of navigate the current allotment of vaccine that we're getting, trying to add those individuals to get appointments when we've already had a significant number of people submit survey pre-registration surveys, and trying to get people on the books for access to the vaccine. So as these groups are coming on board and being added to the prioritization, we're not actually getting more vaccine to accommodate for that. And so it's made it a little bit more difficult for us to be able to get people into the appropriate system, but also to actually get people access to an appointment. So that's just sort of a little bit of where we are right now as we anticipate greater volume of vaccine coming into Virginia in March and April. And now I will turn it over to Rebecca for her segment on equity policy in the health district.
Hi, good afternoon, everyone. So as Ryan mentioned, there are several challenges that we started this response with a mere less than 2 months ago, really. obviously the supply issue we continue to bring up, and the different phases that have been identified at the federal level and then were added to at the state level, and we're working within those here locally. But another issue that we've continued to face is around our data and really being able to identify ahead of time at the pre-registration phase who is pre-registered, who among those have already been vaccinated, some of those challenges. And I know Catherine's going to talk about how the new statewide pre-registration system that's coming online today should assist with some of those issues. But more broadly, we know that this system overall was not set up to be equitable. When you look at the IT structures we were using, understanding how to get the word out in our communities, and even looking at where the vaccine came initially, it came to our health systems, which is really critical. But now we have a little bit more of an opportunity to plan for what an equitable policy might look like in our district. And I will say that we are not alone in this. Nationally, in communities across our country, everyone is grappling with this really inherent challenge. When you have limited supply of a vaccine, how do you get it out to communities across our district who have very different needs? So what we've done is kind of a twofold process. So we do have a unified command group, policy group with representatives that you see on this slide that will be working together to develop and maintain an equitable vaccine allocation strategy, working across our agencies to make sure that that strategy is resourced and staffed, and then also serving as liaisons both within their internal organizations and then across the community. And with that, we've already started talking. We have some really strong initiatives that are being piloted in Charlottesville and Southern Albemarle this weekend. They should have been last weekend, but again, thanks to weather, we've had some challenges there. But that are really more community-led initiatives, and we're hoping to have those in each of our localities with local community leaders directing how those processes work. Because I think the important thing to keep in mind is that there shouldn't just be one avenue or one way that you get access to vaccine. There are likely going to be lots of different ways. We know that one size does not fit all, and that each of our communities has unique challenges that we need to deal with. So with that, we are bringing in some data support, some ethicists, to kind of help guide this conversation. We are looking at the literature that is coming out across the country and the world, really, when we look at how vaccine is being allocated. And this new pre-registration system as well that Catherine will discuss, again, should provide us with much clearer data. And we really continue to ask the state for locality data that includes demographics, because we do want to know, we have to know how we're doing in terms of vaccinating our population, not just by the numbers, but by demographics as well. And then the last thing I'll say is that we've also been informed that there'll be a new state level equity group, which again, I know as Ryan shared some of the challenges and opportunities that we've faced. We don't know how that group will weigh in locally. And we don't know if the guidance that is created will be kind of a statewide policy guidance, or if it's something that we really have to follow here locally. So we're working in an environment that is changing daily, but that doesn't mean that we can't do our best to provide a more transparent process and plan. Next slide, please. So with that, again, back to one size does not fit all. There are lots of different ways that we're trying to get vaccine into our community. We do have those larger fixed sites, and we also are so excited, the outpouring of providers who really want to be able to provide the vaccine both to their patients and their communities. So our hope is that we will have providers in each of our localities that can really focus on vaccinating in their county. So residents in their county, and then also we have these community sites that I just mentioned that are really more making sure, because our IT systems were set up for people with internet, for people who can easily navigate websites, we want to make sure there are other opportunities that people are getting that might be through different networks. So not just through knowing the health department or knowing what we do. We've also started rolling out some place-based sites. So certainly for folks experiencing homelessness, for people in senior housing and affordable housing communities. We've started some last week and we'll continue to provide those throughout the district. And then lastly, those employer-focused sites. Again, we know we've gotten a lot of our school personnel across the district vaccinated, focusing on those school-based clinics, and also for police, hazmat, and fire, and then for some of our farm workers as well. So I think with that, I'll turn it over to Catherine to talk a little bit more about the system that's launching today and what we know so far.
Thank you, Rebecca. And Joe, you can move to the next slide, please. All right, so as of 8 a.m. this morning, Virginia launched a new statewide pre-registration system. What this is initially the backstory for this. So initially, all health districts were kind of left for their own to create their own registration systems. As many of you know, our health district here has had multiple surveys going out for individuals who are 65 plus, those in phase 1A, 1B, 16 to 64 with high-risk medical conditions, et cetera. All of those surveys had now been transferred over into this new statewide system. So this state system is intended for us to have a streamlined database where we can pull information for anyone in our community who needs to be vaccinated. The intent of this is to make it an easier process for us, but also so that we can capture more information about everybody and run reports accordingly. So on the right here, you'll see a picture. This is a picture of the new system itself. The website is vaccinate.virginia.gov, and we encourage everyone in the community to go register through this system if they haven't already filled out one of our surveys. So individuals who have already completed one of our surveys in the health district, which is, I believe, well over 40,000 people, all of your information was transferred into this new database over the weekend. There is an option when you go to this website on the top right to say, check the list, where you can actually check that your information is imported into the system. You can check this by phone number or by email. Of course, patient health information is very important to us. And so the system is very secure, it's safe. It won't publicly share any personal health information. We wanna make sure that we're protecting that, but there is a way that people can check if they're in the system already. Moving forward, when people register through the system, they should get an email with a confirmation code so that they have that code and they can use that to track themselves as well, so that they don't have to look up using email or phone number. So it's a pretty easy system so far. I will say this today has led to some challenges. I'm sure there are many people across the state who have tried to get to this website at the same exact moment today. So it certainly has led to a slow rollout today with the system. A few minor glitches and some changes where we've noticed there have been some case sensitive issues with searching for emails, but all of that is being fixed through VDH and the state today. So they're working hard on getting these changes fixed as quickly as possible. With this, there's also a way that individuals can register over the phone. So we know that online internet access, email, computer savvy isn't for everybody. So there is a phone system that people can call. Our local hotline in the Blue Ridge Health District will be changing tomorrow at 8 a.m. to have the option of two things. So when you call our hotline, you will have the option one of being transferred directly to the state's hotline, where they have expanded to have over 750 staff who speak multiple languages available to assist the entire state in registering. Or you can choose option two to stay with our local hotline to talk about local resources specifically. But we will be deferring to the state for people to get assistance with registering through this pre-registration system over the phone. I think the other important piece, as I've mentioned before, is that individuals who've already filled out our survey have been grandfathered into this new system. We've been told that later this month, there will be an opportunity for individuals to go through and edit their survey responses, because right now our initial surveys didn't capture all the information that this new system has. So we will be encouraging people later on as they update this system to go in and add their additional demographics or any other medical conditions or other information that we should know into this database so we can have the latest information for every person. I think those are the biggest things there. So Joe, we'll go to the next slide, please. This is just a reminder that COVID-19 is still in our community. So vaccines are one really great tool for us to help prevent the spread of COVID-19 and to protect ourselves, really. But it's still important that everybody remembers to wear face masks, stand 6 feet apart, and limit your time indoors with other households. And as a reminder, we still have an executive order in place with a 10-person social gathering limit. So make sure that we are still being cautious. And we'll go to the next slide. That's our presentation for today to get us started. As a reminder, here's the vaccinate.virginia.gov website where individuals can go to register through the state's new pre-registration system. Here's the phone number for the VDH hotline, which is open daily from 8 a.m. to 8 p.m. And then our local health department hotline as well for COVID resources. And now we will open into question and answer.
Great. Thanks, Catherine. Thank you for that information, everybody. Yep, as Catherine said, we will now move on to our question and answer section. For all of our credentialed media, if you do have a question, please click your raise hand icon and you'll be called upon in the order of hands raised. After I call on you, you can ask your first question and one follow-up question. And we'll give each media representative 2 opportunities to ask questions in this format. I actually have a question that was submitted from Sandy Hausman with Virginia Public Radio. And this question is, if residents received their first vaccination elsewhere, for example, at a CVS in Bedford or a Duke Health Clinic in Durham, can they get their second shot closer to home? And if so, what steps would they have to take to arrange that?
And Dr. Bonds, will you answer that?
Sure. It's important for everyone to understand that the second dose allotment that every vaccinator receives is based on the number of first doses that you gave. So right now we get second doses for all of the people that we gave their first dose to. So the best way to get your second dose is to go back to where you got your first dose, because we know for sure they have a vaccine waiting for you there. That said, we do understand that there are rare circumstances where that's not going to be possible. For varieties of reasons, maybe you got your first one in a long-term care facility and now you're out. Maybe it was an individual who was incarcerated in jail and now has been released and needs their second dose. Lots of situations where you just couldn't get your second dose where you got your first one. And we are prepared to deal with those on a case-by-case basis. And I think the best way would be to call our hotline or use our Gmail account. And Catherine, maybe you could put that in the chat so that the reporters have that, and explain your circumstance, and we'll try and work you in. But the public needs to understand that we don't actually have your second dose. What we're doing is taking a first dose and using that to give you your second dose. So these situations should be very rare. And really we should, I'm encouraging everyone to go back to where you got your first dose, because they have your second dose waiting for you.
Thank you, Dr. Bonds. Our next question comes from Sean Tubbs with Charlottesville Community Engagement. Sean, you're on with the Health District. And Sean, your mic was enabled. You'll have to unmute.
Joe, I thought you were going to do that for me automatically. Thank you. Thanks for that. The question I have builds off of the last question we just heard about the CVS appointments and that system. And this, and you know, I'm seeing a lot of people who are going outside of the area, sometimes out of state, to do this. And also last week, Dr. Avula expressed concern about the lack of equity in terms of determining how that process works. How does this new system interface with the CVS system? And can you confirm that that's a separate process that local and state officials don't necessarily have any control over?
Dr. Bonds or Rebecca, do you want to answer this one? Okay.
Yeah, I think I'll tackle this one. So the CVS system is not associated with the statewide distribution. So this is a program that was stood up by the federal government using a separate allotment of vaccine given directly to CVS for distribution within particular states, and Virginia was one of them. So the good news is that means that Virginia gets another 26,000 doses that we wouldn't otherwise have access to. However, CVS has its own registration system that does not integrate at all with our system. And so the list that people are on, we aren't able to send those to CVS at this moment in time. We have made that request. They are looking at it internally with their IT system. But right now, your best option if you want to get vaccinated through CVS is to go to their webpage and try and register. And when you register, my understanding is that you make both your first and your second dose appointments. And so if you're going to register for one that's quite a distance from your house, just be aware that you're going to have to go back there in 3 to 4 weeks to get that second dose. Because again, they have your second dose. I don't have that second dose. So it's a great system, and we did try and alert everybody over the age of 65 that was on our list that this was now another option, but you do have to register separately. It is not integrated into the new statewide system.
Thank you. And just a quick follow-up on that, I guess, do you anticipate, and this is a speculative question and I apologize, but do you anticipate in the future that you might have people who might be confused that they signed up for one and they don't know the difference between them and somehow they end up without a vaccination?
Yeah, I think it can be really confusing for individuals. And so I think it's really important that we try and get the word out. I think CVS is a great resource, and I'm really excited that they're here because again, that's 26,000 doses that we wouldn't otherwise get in our health district every week is my understanding. So it's a substantial amount of vaccine that we're getting access to, but I think it's really important for everyone to realize that if you registered with CVS and have an appointment, you need to go to the CVS to get that shot, and you need to go back to CVS to get that second shot. And if you registered and got your shot at one of the health department affiliated sites, then you need to come back to us to get your second shot. So I agree, there's potential for confusion there. We're certainly trying to do our best through messaging and really look forward to partnering with you all to make sure that that message gets out.
And Sean, just to follow up as well, I think it's helpful to know what we've been told with the pre-registration system at the state level is that for the first time, we'll be able to see when people get vaccinated. So if they're on our list, but they've also registered with CVS or another place, we'll actually be able to see, based on our list, how many people have gotten vaccinated elsewhere and maybe even out of state, to the point raised earlier. So that is helpful from a planning perspective and from a kind of a data perspective.
Great, thanks, Sean. Our next speaker is Riley Wyant from NBC 29. Riley, you're on with the Health District. You have a question and a follow-up.
Awesome. How's everybody doing? Hanging in there, I'm sure. Okay. So my question is, what do you do with leftover vaccines if someone misses their slot or misses an appointment? What happens to those leftovers?
Ryan, do you want to take this one?
Thank you for that question. So when we work with our localities or operate out of the Kmart location, we want to make sure that we work with them to work down a list. Right now, it's primarily 1A providers who have yet to get access to the vaccine. And so as we're nearing the end of our day, so somewhere around 2 o'clock, if we're finding that either people did not show up for an appointment, or maybe we got an extra dose or two out of a vial, we'll communicate with our point of contact, who can then contact someone from their list to get them to come and get vaccinated. There's not a great system in place that allows us to do that independent of our partners. But we feel at this point, using those lists of 1A providers allows us to work through that list a little bit at a time if there are doses that we have in surplus, I guess, towards the end of the day.
Gotcha. And just a follow-up to that. So it's a wait list of sorts, or?
I wouldn't say it's a wait list. I think it's more individuals who have yet to get access to an appointment or been able to make an appointment through VAMS previously and what will be PrepMod, who are also in 1A. And so it just allows us to provide that 1A access. But I wouldn't necessarily say it's a wait list. They're just individuals who have yet to get access to an appointment.
Okay, our next question comes from Nicholas Cropper with the News in Advance. Nicholas, you're on with the Health District.
Hi, can you all hear me okay? Perfect. For my first question, it was mentioned that we have these new groups being added to our 1A phase. I'm curious as to exactly how we anticipate that affecting the timeline as we try to move into these other groups in phase 1B.
By adding more groups or more individuals into phase 1A, it's just going to extend that process in terms of moving through the rest of 1A, but then also moving into different categories in 1B. We're trying to dovetail as much as we can, but it's just going to take that much more time to get through that process and to getting people access to the vaccine, particularly because we're not getting more doses per week, even though more individuals are now eligible for the vaccine.
Great, thank you. And just to kind of follow up with that question as well, do we have, how many of our weekly allotment of vaccinations, how many of that is going to phase 1A population as opposed to phase 1B at this moment?
I don't know that I have a good number on that because part of it is based on the appointments that are already scheduled in VAMS. And in VAMS, we can't really pull out the information of who's 1A versus 1B. And then also we're allocating certain numbers for individuals who are 65 and above. We're allocating for different sites that Rebecca had mentioned, community centers, churches. And so it's a little difficult to discern between 1A and 1B, in large part because our systems don't differentiate between the two. We just have individuals within that system who are listed.
Next up, we have Jesse Higgins with Charlottesville Tomorrow. Jesse, you are on with the Health District.
Hi, can you guys hear me? So thank you for hosting this. It's actually extremely helpful for all of us. My question is probably one for Ryan, but perhaps not. Can you elaborate any more specifically about who you guys are vaccinating right now? I know it's 1A and some in 1B, but is there a way to list out like who those individuals are that can get the vaccine versus the rest of the 1B that's still waiting?
So specific to 1B, we were trying to work through 1B1, 1B2, 1B3. One of the struggles that we found with VAMS is that anyone who is in 1B, so if it's an essential worker, if it's someone who's in the postal service and they have access to VAMS, it didn't allow us to sort of set appointments in that particular order. So primarily we're working through 1B1, 1B2, and 1B3, which gets us through fire, hazmat, police, corrections officers, homeless population, educators, and then in 1.4, it's more of the broader agriculture. But we do know that there were some individuals further down the list who were able to get access through VAMS just based on the way the system is set up. So we're still trying to work through that list in that order while also providing access to those 65 and above, and then working on how we're going to increase access for those who are 16 to 64 with underlying health conditions. So it's not a straight, sort of straight line through those groups. It is a little bit of a dovetail and a little bit of a mix. But understanding now that we have a little bit more control with PrepMod in terms of who we provide access to clinical appointments, it's going to make it a little more efficient for us to work through those lists in the order intended, but then also provide hopefully greater access for those broader groups that aren't in sort of a 1B1 or 1B2 category, speaking of the 65 and above and 16 to 64 with underlying health conditions.
Okay, yeah, that was actually going to be my follow-up question, which is like, what about that 16 to 64 underlying health conditions? Like, when do you anticipate that being more broadly open, or did you just say it kind of is now?
Well, it's technically it's they're eligible at this point. I think one of the things that we're struggling is how do we prioritize access within that, and how do we open up access to that? Where do those lists and individuals come from? And so part of that will be pulled from surveys that we've already collected, but also anticipating what the new site that VDH has built or the governor's office has built, the Vaccinate Virginia component, so that we can then take those lists and provide additional access. Again, we're still limited by the number of vaccines that we're getting on a weekly basis. So even though we can get that information, providing actual appointments is a totally different challenge that we're going to have to overcome.
Can I just chime in here as well? I think this is a really important question because there are many, many people that would fit that 16 to 64 with a additional medical condition that would put them at high risk. And so we've actually asked the state to come up with some statewide guidance for us on how to best approach this, because I think it's for the state a really critical issue that we have some uniformity moving forward. So we could certainly figure out in our health district how to a way to do it. But that's going to create a lot of problems if the way that we choose to do it is different than the way our neighboring health districts do. So we're really looking for some guidance to figure out how to best stratify. There are many, many people who fit this age group. I think when you look at our hospitalization, targeting those over the age of 75 and now down to the age of 65 does really reach a large majority of people who have a really adverse outcome. That's not to say that people 16 to 64 can't have an adverse outcome or can't have an ill effect from this disease. But as I've said, we really are looking towards the state to help us with some guidance so that we have consistency across all of the health districts.
Okay, and Sandy, I do see your hand up. You do represent our second line of questioning. So I do see a couple that have not participated in the first round. So I'll give an opportunity to those to raise your hand now. Okay, and we will move on to our second line of questioning. And first up is Sandy Hausman from Virginia Public Radio. Sandy, you're on with the Health District. Sandy, you are permitted to talk. You just need to unmute your mic.
Sorry about that. God, that's terrible. A quick question about demographics. Is our district older proportionally than others? Do we have more people over 75 than other health districts? And I think this is a really huge question. What about all these variants that we're hearing about? Is that going to screw things up? Are we going to have to go back and revaccinate people with new vaccine because the stuff we've already gotten is not going to work?
Dr. Bonds, are you willing to take those as well?
Sure. So it's a great question. Looking at the demographics, we know lots of people retire to this area. It's a really desirable area to live in. And we have lots and lots of people who specifically choose Charlottesville as a lovely place to retire to. So do we have more? Well, I guess what are we comparing it to would be one question to think about. But we certainly have a lot of retirees. So I don't want to rank with other health districts, but I think it's fair to say that they do make up a big portion of our population. With regard to vaccine variants, this is certainly a very worrisome problem. Viruses are really good at changing. That's what they do best. And so it's not surprising that we're seeing lots of variants across the world, really. I think what we have seen so far is that the vaccines that we're using, the Pfizer and Moderna, seem to be doing a good job against the variants that are common in the area. But we don't know what's going to happen next week or next month, obviously. And so it might be at some point in the future that people will have to get a different booster vaccine to cover some new variant that has arisen. I just don't know. I wish I had a crystal ball, but I don't. It does mean, though, that it's really important that we vaccinate as many people as quickly as we can. And that's a really challenging situation right now because we just don't have the vaccine to even meet the current demand of people who would like to get vaccinated. So I think you see that on a federal level. You see lots of work being done to try and increase the supply of vaccine. And we're certainly trying to make sure that all the vaccine that we get in, we go out that same week, weather permitting, so that we're not sitting in our freezer vaccine. So more to come, I think, on the variants and what's going to happen with regard to the efficacy. But currently, it appears that the vaccines are efficacious against the most common variants.
And next up, we have Riley Wyant from NBC 29. Riley, you're on with the Health District, and you have your second and last question and follow-up.
Awesome. So I know that inmate vaccinations have begun, but when does BRHD plan on vaccinating people in other congregate settings, such as homeless people living in the Haven?
Hi, I'm happy to take that question. Yeah, so we have several clinics scheduled over the next couple of weeks for those communities. And I think one of the challenges that we run into is wanting to make sure that when we're vaccinating in a community, in a specific place, that we respect that community and the people there. And so we might not want to advertise widely or through the media about those clinics, because we want to, again, be respectful of the community members that are living there and also of the community leaders that are organizing those. But we do have several clinics coming up.
Gotcha. And another question, we got a lot of viewer calls today just with issues with the new pre-registration website. And I know it's been a challenge and it's been a huge learning curve, but what can you kind of say to these people that, wait for hours on hold on the phone or can't get a hold of the website and it's just issue after issue? I mean, is there a light at the end of the tunnel?
I certainly believe there's a light at the end of the tunnel with this new system. We understand it's a challenge. It's been a challenge for us as well. It's brand new. So today is day one of a statewide database for millions of people to access. So if everyone's trying to access it at the same time, it's bound to have some complications and some problems. Be patient. Anyone who I have worked with the state to make sure that our local list of anyone who had completed a BRHD survey of intent to be vaccinated was successfully transferred over into this new database. There is an option to check that online. I believe getting online is going to be the fastest option at the moment. However, we recognize that with everybody trying to be online at the same time, it's going to cause some problems. So check within the next few days. It's going to take a little bit of time. There's going to be some hiccups over the coming weeks, but we are working on it to be a very efficient process and can ensure people that at some point they will definitely be able to double check that they're in the system, whether it be online or by calling the hotline.
Next up, we have Jesse Higgins with Charlottesville Tomorrow. Jesse, you're on with the Health District.
Oh, hello, can you guys hear me? All right, hello again. So this is actually not a question about vaccinations. It's more about community spread. I'm wondering if you guys can pass a little bit of judgment on how we're doing and if we're moving in the right direction, and if possible, kind of tell us where the spread is happening these days.
I think there's a few of us who could answer that. I can at least start with saying in early January, we saw some of the highest case numbers that our district has seen yet. And this was before UVA students were back. And a lot of that was from small social gatherings and family social situations where multiple households were merging. So we have seen a huge increase. As Dr. Bonds shared earlier, UVA students are back and they are testing thousands of students a day. So it is skewing our positivity rate, but we are certainly still seeing high case numbers throughout the district. And I'll say, Ryan or Dr. Bonds, do you want to add add any more?
Yeah, I can add a little bit to that. I think you see the numbers coming down, and that's a really good sign. I think, as Catherine pointed out, the holidays, a lot of stuff was spread, and it wasn't all cheer. There was a lot of viral spreading as well, unfortunately. But I think we're seeing a good downward trend right now. I think things that will be helpful is that we are going to be entering into spring soon, and people will be more likely to spend time outdoors, and we know it's safer to be outdoors to do any of your activities, and so that's going to be really helpful. And more people will be vaccinated, and we think that that will also help. I hope it'll help in the long term. So I think people need to continue to be vigilant, and they need to continue to do all of the mitigation measures. Even if they're vaccinated, they still need to continue to wear a mask. So it's really important that people understand that. But I am cautiously optimistic that we're seeing a good trend right now.
And next question comes from Mac McKenzie with the Daily Progress. Mac, you're on with the Health District.
Hey, it worked. It's been giving old man an iPhone and everything goes to hell. I was wondering, I talked to a couple of folks who are lining up with CVS, who are 1B through the state, and they got kicked off the CVS site saying they weren't eligible. Do you know, is the CVS site working with the federal guidelines, which are different than state guidelines? You may not know that, but I've heard that from a couple of folks. So.
The current guidelines for CVS in Virginia right now are 65 plus. So if they're an individual who fits into phase 1B as an essential worker, or someone who is 16 to 64 with a high risk medical condition, then they wouldn't qualify, as Virginia has requested that CVS follow a 65 plus to get started, and then will likely expand.
Okay, that would explain it. They're 64 and high blood pressure or something, so cool.
Mac, did you have a follow-up?
No, it was nice and easy. The rest of you guys have been doing all the hard work for me.
Very good, thank you. And next question is from Sean Tubbs with Charlottesville Community Engagement. Sean, you're on with the Health District.
Great, thanks. Yeah, just building off of Jesse's question a second ago, tonight City Council is going to reconsider their ordinance, which I believe is slightly more restrictive than the state's in terms of gatherings. There are some groups that are petitioning for sports gatherings in the city. Do you have any guidance, or do you have any thoughts about what the City Council might do this evening? And it's okay if you don't. I'm just wondering. I just thought I'd check.
Yeah, so I don't want to get in front of the City Council. I think I can give some general guidance that at this point in time, they're still active. Many individuals are infected, and it is still quite easy to contract a case of COVID. And people still see very devastating consequences of COVID if they have not been able to get vaccinated. And we know from our case investigations that sports groups can be one of the ways that people contract COVID. So I think it's critical that people remain vigilant in their activities. And I think we all have a personal responsibility to think about that, to really think about, is there a way that I can make this safer, both for myself, but also for my community and for my family that I might bring an infection home to. So I don't really directly address your question, but spread does happen through sports activities. It is still in our community, and I think we need to maintain our heightened sense of awareness.
Thanks. That's it for me.
Thank you, Sean. And that appears to be all the questions that we have. Catherine, I'll go ahead and hand it back over to you.
Great. Well, thank you all for joining today. Thank you to our panelists, and especially thank you to the City of Charlottesville for hosting this press conference for us and for all of your support. And thank you to our media partners who are helping to spread all of the right information. We appreciate that. So we will wrap up today's press conference with just another reminder, as Dr. Bond has said multiple times, it's still important that everybody is wearing their face masks and standing 6 feet apart and limiting your time with others. It's been a really long year. It's 11 months since we had our first case in this health district. And I think we're all very tired, but we are getting through it, and vaccines are only going to get better from here. So we appreciate the community support, and we'll continue to provide more updates as we move forward. Thank you all.
Great. Thanks, guys.